Contrary to orthodontics being the oldest specialty, sir, do you think the field is still in its infancy?
Contemporary way of going about the specialty now. So we have really moved ahead.
What inspired you to choose this field?
All branches in dentistry are really great and fabulous, and all of them have a really great future.
Do you listen to music while treating patients? And if yes, Bollywood 90s or ghazals?
What message or perspective would you offer to students navigating this challenging path?
You have a good teaching, learning, and patient exposure and experience, or you have less of that in another place.
Orthodontists have been ranked the top 100 best jobs in the US News and World Reports of 2024 list. How do you view the evolution of orthodontics in India?
There's nothing like getting specialized in orthodontics and creating those smiles.
As a student, did you prefer studying late night or early morning? Welcome to Orthodontics Unwired, a podcast where we dive deep into the artistry, innovation, and untold stories behind the world of orthodontics. I, Dr. Himanshi Chandani, a BDS intern and smile enthusiast, joined by Dr. Amrit Singh, an MDS student specializing in orthodontics.
Today, we are honored to be joined by a towering figure in Indian orthodontics, an academician, clinician, leader, and a mentor par excellence. He has been recognized with prestigious National Best Professor Award by the Honorable Indian Orthodontic Society, and as a convener, led his group to win the Best Study Group Award in Delhi. With over 100 publications to his credit and an illustrious career spanning over 2 decades, he currently serves as the head of the Department of Orthodontics at Santosh Dental College.
A former vice president of the Indian Orthodontic Society and the organizing chairman of the upcoming 60th Indian Orthodontic Conference, he truly stands at the intersection of innovation, leadership, and legacy. It is a true privilege to welcome Dr. Rajiv Ahluwalia, sir. It's an honor to have you with us today, sir. Thank you for taking the time to join this conversation.
Thank you, Dr. Himanshi, and thank you, Amrit.
So we have come a long way. Orthodontics didn't begin in a sleek clinic or with digital scanners. It started with tombs. The earliest evidence of orthodontic practice dates back to ancient Egypt, where crude metal bands were found on mummified teeth, suggesting that the quest for a perfect smile had begun, though probably without patient consent. Fast forward to 19th century, and this field gets its first real architect, Dr. Edward Angle. He transformed orthodontics into a recognized specialty, but the evolution did not stop there. Enter Lee Graeber, who expanded this horizon and emphasized that orthodontics was deeply connected to facial growth, function, and harmony, helping establish to what we know as dentofacial orthopedics.
Born in the tombs of Pharaohs, shaped by Angle's vision, elevated by Graeber's wisdom, the journey of orthodontics is a story of innovation shaped by visionaries, and we are still adding chapters. Contrary to orthodontics being the oldest specialty, sir, do you think the field is still in its infancy?
I don't think at all the field will be in its infancy. We've come really a long way, and there's a very contemporary way of going about the specialty now. So we have really moved ahead.
You've built quite a reputation in the world of orthodontics, sir. So I'm curious, what inspired you to choose this field? Was there ever a moment that made you realize that this is the path you want to go for?
To be honest, at the undergraduate level, ortho is not so inspiring, I would say, because, there's very basic wire bending. But as a society, it was always the most preferred branch in dentistry. So when I got the option that I could choose a branch, although endodontics was in my mind, first of all, I want to say that all branches in dentistry are really great and fabulous, and all of them have a, really great future in India. But definitely, ortho was my first choice. That time also there was a enigma about orthodontists, so I wanted to be an orthodontist.
Sir, if you were picking this branch, if you were in a situation to pick a branch again in this era, would you pick orthodontics again?
Orthodontics is my choice.
So now it's time to shift gears for a bit of fun, sir. So welcome to a rapid fire round where we ask quick questions and expect even quicker answers. So no overthinking is involved. Whatever first comes to your mind, sir. So
Okay,
are you ready?
I'll try.
Okay, sir.
Sir, we'll be keeping these questions relevant and fun too. What is your opinion on do-it-yourself aligners?
So you want to begin on a catchy note. Yeah, but this is a very relevant question these days, and everything actually, the market moves around what the consumer wants. If at all we can relate, a medical specialty with the market. So the companies, they see what is going to attract the patient, what are the current issues and how they can get over it. So, it would be very easy if at home I can do my angioplasty myself, do it yourself. So, but it's not so simple.
Right.
So, and different countries, different places have different regulations in place. So, you have to see where you are and what the regulatory bodies do, and everyone must abide by that. So, definitely DIY is definitely no, and it's harmful to the patient.
So the next question, if not ortho, then which stream would you have taken in this era?
Orthodontics and dentofacial orthopedics.
So I actually already answered that.
Yeah.
Sir, after a busy day at the clinic, what is your favorite way to unwind?
Favorite way is I am a movie buff, so I like watching thrillers. So if I'm left to myself, I'll be happy doing that.
Sir, Bollywood or Hollywood also?
Both. I like both.
Okay. And if you could go back to your PG self and give yourself one advice, so what would it be?
In the hindsight, I feel my PG time was really the best time, in my span. So I really wouldn't wish to change anything.
Oh.
Yeah.
Sir, do you listen to music while treating patients? And if yes, Bollywood 90s or ghazals?
It's different at different times, Sometimes I'll be listening to Kishore Kumar. Sometimes I'll get into Rafi. And sometimes, contemporary English music. So it varies on the mood.
It's great to hear that, sir. You prefer.
Yeah.
Do you prefer attending conferences in person, sir, or virtually?
Definitely in person. So because that's something we really look forward, annually, meeting our old friends, the new people who have joined, what's in the scientific. So that's something exciting we look forward to. I look forward to.
Sir, as we know, you did your PG from Manipal College of Dental Sciences. Do you have a mentor who significantly influenced your academic journey?
I did my post-graduation from Mangalore College of Dental Sciences, Mangalore. And definitely our boss, Dr. V. Surinder Shetty, he's a mentor. He's somebody I can never forget, because not only he taught us the art and science of orthodontics, we learned lots more at that place.
So, sir, moving towards a more serious question. In an era where competition in dentistry is more intense than ever, sir, especially with the pressure of NEET rankings and the stigma often attached to pursuing PG from private institutions, what message or perspective would you offer to students navigating this challenging path?
See, if you, are a hardworking student and you are a good academician and you've got a good rank and you've got a good government college. So first of all, I would not like to differentiate between government college and private college. So it's either you have a good teaching, learning and, patient exposure and experience, or you have less of that in another place. So it's got nothing to do with private or government. Now, coming to your question, I've been, for the last 2.5 decades, I've been in this profession. And there is no, what would I say? There is no yardstick as, a government pass out is going to do better or going to do less better than a private institute pass out. So it really depends on the individual. It actually really depends on the individual and the kind of passion you have for it.
Okay, sir. Moving back to another fun segment. We have this segment called This or That. We'll give you two options and you just have to pick one you prefer. No explanations required unless you really want to, sir. First question. Sir, we have seen multiple philosophies in orthodontics. Two major groups that we have seen emerge are angle philosophy and tweed philosophy. What are you an advocate of?
My philosophy. So you have to see, major part of orthodontics is mechanics. So you have to understand all these concepts. And in the end, when you are moving a tooth in every patient or, in different areas, you have to have a very simple kind of mechanics clarity in your mind. And then you're the boss. So definitely you imbibe from everywhere and you do what you want.
So moving to the next question, sir. What would you choose, clinics or research?
Where's academics? So research and academics.
Research and
Yes, sir.
There, you asked me a question, who's your mentor? So our boss, while after passing out, I asked boss that the same question, whether you should get into clinics or you should get into academics and research. So he told me something which I can't forget. And it was so true. He said, Rajiv, if you can do both, it's best. If you have to choose one, choose clinics. And I really agree with that.
Sir, another ortho-based question. Self-ligating brackets or conventional braces?
I don't believe self-ligating have a real advantage. So I'm not much of a self-ligating person.
Sir, as a student, did you prefer studying late night or early morning? Like, were you a night owl or an early bird?
Actually, I prefer more of early morning. Yeah.
Okay.
Sir, again, we'll be going to a controversial topic over here. Aligners or braces?
Again, my answer remains the same, that you need to know all the philosophies. You need to know the science and mechanics behind it. So that will let you know, because when the patient is coming, you have to give the patient autonomy to decide what they want to do. Then at the same time, you have to do justice with the patient. So if the patient is trying to choose in its autonomy that I want, say aligners, and you feel in your hands, you won't be able to do real justice with that. So then you must be very open and very transparent with the patient. So in the end, it's your choice. It's mixed, I would say. It's not either.
So, sir, the next question. How you prefer working in the clinics, with apron or clinical scrubs?
Clinical scrubs is a relatively new thing. We never had it when we were doing post-graduation. So what I tell my postgraduate, usually what you will practice in your postgraduate days is what you will be doing. To the extent what you have learnt in your postgraduate days, that will become your strong points, and what you did not learn will always remain a weak point unless you learn it later in life. So yeah, apron.
So moving on to another long answer type question. Orthodontists have been ranked the top 100 best jobs in the US News and World Reports of 2024 list. With all the momentum, how do you view the evolution of orthodontics in India?
As far as my knowledge goes, in India, orthodontics is the oldest branch, oldest specialization.
Yes, sir.
So I think it was always a favorite branch to take. And I think it still is. Like I told you, if I am given a chance today, I will definitely take orthodontics. So yeah, there's nothing like, getting specialized in orthodontics and creating those smiles and, and giving those children that experience of transforming their smiles. So yeah, it's really fulfilling.
So do you see any competition that we are facing from any other stream?
I would not call it competition. Now what has happened is there is a lot of interdisciplinary work with the patient and also in research. So rather than competition, now it's, as adjuncts. So it's in collaboration. Orthodontics will work in collaboration with an endodontist, with a prosthodontist. Suppose there is a molar missing and the space has lessened over the years. So first you have to open up that space to put an implant. So basically it's of advantage to the patient. You have to think how it's going to help the patient and not how it's going to help you. So in that process, if you keep that as your major goal, how it will benefit the patient, so you will easily understand that all the branches and specializations need to work in collaboration for the best outcome.
So multidisciplinary for the future.
Yeah, definitely.
So moving towards the next question, sir. We often hear about India becoming a hotspot for dental tourism. So with patients flying in for everything from smile makeovers to full mouth rehabilitations, in that landscape, where does orthodontics fit in, sir? Do you think you're tapping into its full potential yet?
See, whether it's medical tourism or dental tourism, why there is, first of all, medical and dental tourism from the West to this part of the world is for two reasons. One, that the treatment is available faster. Probably in the West, even if you want to, have an emergency, or if you want to take some kind of treatment, maybe there's a long waiting list. You have to wait for weeks or maybe even months for some country, even for a cavity. So, second is the expertise, and the competence, which in our part of the country, in India, it's really good. So patients would like to come in from abroad because they can immediately get the treatment done. They are in competent hands. And also a byproduct is they are able to save a lot of money because it gives, really affordable healthcare, and quality affordable healthcare is possible here, which in fact is also the vision of our institute.
Sir, so that brings us to a segment which we are really excited about, Bust the Myth. So, sir, we have collected a few myths, common myths about orthodontics, and we would like you to burst them for us, where we take a closer look at some of the most common misconceptions in orthodontics. So, sir, first one is braces are only for kids and teenagers.
That's not true. I think now even everybody knows that adult orthodontics is definitely a major part of orthodontic treatment, and more so when interdisciplinary is also there. So adult orthodontics is quite a major part, with cosmetic procedures also coming, with the aligners coming. So a lot of adults who for some reason were not able to take this treatment are venturing into it now. Yeah.
So we've seen a lot of brands claiming that they can reduce the treatment timing of orthodontics. So I want to frame this question as, do aligners really work faster than braces?
So Himanshi is an intern, but you are doing post-graduation. So what do you think, Amrit?
Sir, I feel the answer to that is braces and aligners go hand in hand, and it depends on your mechanics. But a few cases, I feel braces work faster, while in closing spaces, sir, I feel that aligners also do a good job.
Yeah, but I think we were talking about the time, right?
Time.
Which is faster. So again, you have to get into the mechanics and physiology. Only if you put optimal pressure on a tooth, you're supposed to put only optimal pressure, neither less, neither more. They are harmful. So if you put optimal pressure, the tooth will respond in a physiologic way. So whether you're putting that pressure with your finger, or whether you're going to put that pressure with a removable appliance, or with aligners, or with fixed orthodontics, the result will be the same. The acceleration will be the same. So I feel there's no significant difference.
Okay.
So next question is, teeth stay straight forever. This is the common myth people have.
Probably in these days we can classify it as a myth, and permanent retention is recommended these days, lifelong. So probably maybe it's a myth now.
So Do braces set off airport security, or are you required to remove them before an MRI?
No, they both are safe. Both are safe.
So, as we come to the end of this insightful conversation, sir, what would be your final message or key takeaway for our listeners, especially the young dental professionals and students?
I would say that the specialty of orthodontics is, at the undergraduate level, it remains kind of an enigma, like I told before. And once you get into your post-graduation, it's really interesting. There are some, it doesn't really require long drawn-out hours or not much emergencies in orthodontics. And you're dealing with mostly young people. And once you transform their smiles, it gives you a lot of satisfaction. So in that regard, I feel that taking up orthodontics is really, really a sensible and a recommended choice, by me at least.
Thank you so much, sir.
Thank you, sir.
Thank you for your words of wisdom.
Thank you so much, Amrit. Thank you so much, Himanshi.
Thank you for watching our episode, and do tune in to our YouTube channel for watching such more insightful episodes.
And please hit the like button. If you have any further questions, you can put them in our comments.